Good morning, one and all. Today, on the 27th of March, we have gathered here for a webinar on multiple sclerosis. This month, March 2022, being the Multiple Sclerosis Awareness Month, we thought of getting somebody who could guide us, who could give a general overview and awareness regarding multiple sclerosis. We couldn't find anybody better than Dr. Gajanan, who has been a speaker earlier as well on the IPWC platform, and we are very happy to have him again. Without much delay, I would request Dr. Riddhi to take over and start with the webinar. Dr. Riddhi, please.
Good morning, everyone. It's my pleasure to introduce Dr. Gajanan Panandikar, who has done his MBBS from Goa Medical College, MD in Medicine, and DM in Neurology, DNB in Neurology from Seth GS Medical College and KM Hospital, Mumbai. He is a former assistant professor in neurology at KM Hospital, Mumbai. He is trained in comprehensive management of refractory epilepsy with interpretation of video EEG and intraoperative electrocorticography guided epilepsy surgery. He is trained in management of acute stroke, including thrombosis. His interests are stroke, epilepsy, autoimmune neurology, and neuromuscular disorders. He has done several original studies and research publications and presentation in various conferences. He is a member of Indian Academy of Neurology, Maharashtra Association of Neurology, Indian Epilepsy Society, and Neuroimmunology subsection of IAN. Over to you, Dr. Gajanan. Please start with your presentation.
Thank you for your kind welcome. And thank you for the opportunity to talk on an important topic called multiple sclerosis. It's a very important disease which is affecting lives of many people, especially young people. So what is multiple sclerosis? Is it rare or it's a well-known disease? So multiple sclerosis is a well-known disease. In a movie Guru, the role of the Vidya Balan played a role of a person suffering from multiple sclerosis. So it's a common disease, and if not treated, it can be disabling. So it was initially described in the 19th century with various pathologists and the neuropathologists describing the MS-related changes. And a very well-known neurologist called Jan Charcot, who is the father of neurology, he has described feature of MS in 1800s. So what is multiple sclerosis? It's thought to be an immune disorder, autoimmune disorder. What do you mean by autoimmune? Autoimmune means the certain cells in your body which are supposed to actually fight viruses or bacteria, any infection. They start attacking your own body, own nerves, own cells, and various parts of the body. So the name comes from the multiple, means it affects multiple parts of your central nervous system, and sclerosis means scarring. So it causes, because of recurrent attacks of inflammation, it can cause scarring in your brain and different parts of your central nervous system. So what does it do? It attacks the myelin coating, which I'll be describing later, affecting the nerves in the central nervous system, which involves brain, spinal cord, so optic nerve. So it can affect any part of your brain, spine, or your cranial nerves. So who gets MS? So it is usually diagnosed in this between 20 to 50 years of age. Occasionally or rarely it is seen in younger age group or older adults. Most common is in this formative age group. It is more common in females than males, so 2 to 3:1 ratio. It is more common in European countries, Mediterranean countries, and temperate areas, which is far away from the equator, but it is also seen in India quite commonly. So what MS is not? So there are many misconceptions about multiple sclerosis. So it is not contagious. So it's not an infectious disease. It's an immune disease. So because of immune disease, it's not contagious. It is not directly inherited. So it is not that if somebody is suffering, his children or his anybody will be suffering from multiple sclerosis. It is not always disabling. So it's a diagnosis of MS can be very scary for the people, especially when there is not much of literature available for patient education. So it is not always disabling, but sometimes if not untreated, it can be disabling. And it is usually it is not fatal, except in very, very rare cases of very fulminant MS, which are less than 1% of the total cases. So being diagnosed with MS is not a reason to stop working. So it's not a reason to stop doing things which you enjoy, and it's not a reason not to have children. So because this is most common in females and more common in females in the reproductive age group after 20 to 50. So these are the questions which they come with, and but you should know that it is not a disease which prevents you from having children, or it's not that it is inherited, so it will not be transmitted to your children. So there is always a genetic predisposition for many disorders. So the risk of getting MS is approximately 1 in 750 of general population. Close relative of MS will has a little bit higher chance, so it's 3% chances. However, twins have a 25% chance of getting MS. 20% of patients with MS has got a blood relative with MS. However, this doesn't mean that MS is directly inherited. Though the person with MS, there is a little bit higher chance compared to general population that the family member may be having MS, but it's not that it is not a compulsion, or it's not that person with relative of MS will have multiple sclerosis. So what is a prognosis? So multiple sclerosis is a highly variable course in different individuals. So we see patients who have been having only one attack throughout the lifetime, or there are patients who are having multiple attacks within short course of time. So it's an unpredictable disorder. Approximately 1/3 will have a very mild course, which improves very drastically with treatment. 1/3 will have a moderate course, and 1/3 will be disabled. So certain characteristics usually have a better prognosis. So females have better prognosis compared to males. Younger onset, so age less than 35 years of age, the disease onset before that, it has got good prognosis. A person who present more with sensory symptoms like tingling, numbness, or loss of sensation, they have better prognosis or better outcome compared to people who come with weakness or paralysis. Those who have a monofocal rather than multifocal episodes, and those patients who have got complete recovery following a relapse, I will be discussing this later. So they have a better outcome. So these are certain characteristics which we take into mind when a person comes to us, so that we can prognosticate them and we can keep watch for any further relapses. So MS is a combination of a genetic predisposition and an environmental trigger, which could be infection. The exact trigger has not been known, but it could be infection, it could be stress. So both these factors together, they cause a strong autoimmune attack on your nerves. So there is loss of myelin and nerve fibers. So what is myelin? So myelin is the covering of your nerves. So it is a fatty layer which covers your nerves in your brain, in your spine, in your peripheral nerves or cranial nerves. So this myelin is required for faster transmission of nerve impulse. So whenever you have to walk or you have to do any activities, you need to have a electrical signal from your brain to your organs, like your hands to your legs. So this is carried to your nerves. This is decided in your brain. So for this to act at a faster level, so because this occurs in a very split of a millisecond, so this has to occur at a very fast pace. So this myelin layer on the nerves, so this improves the speed of nerve conduction. So it increases the velocity of your nerve conduction. That improves your thinking. It improves your speed of any activity. So in MS, what happens is the activated T cells, or the immune cells, which are actually supposed to fight infection, they cross the blood-brain barrier. So they reach your brain and they launch attack on your myelin and nerve fibers. So they will start binding to that myelin on the nerve fibers, and they start damaging the myelin. So what will happen if a myelin is damaged? So as you can see in this picture, this is the structure of an axon in a neuron. You can see this is the myelin, which is a covering. So what happens is generally the electrical impulses, they just jump and they go at a very fast rate from one neuron to another. MS causes destruction of this myelin. So what you can see is initial, this is we consider single attack. Gradually the myelin will get destroyed. Gradually the whole neuron will get destroyed. So what happens because of this is there is damage to nerve conduction. So what are symptoms of multiple sclerosis? So as I told you, multiple sclerosis can affect any area of your brain or cranial nerve or any part of your spinal cord. So because of that, it can come with various symptoms, and because of that, it may be missed The diagnosis may be missed by in early cases because it can affect any part of your brain or the spinal cord. So most common which we see in our practice are visual symptoms. So the most common symptom is sudden loss of vision. So painful or painless loss of vision. Suddenly in one eye or both eye you may lose vision. You can have double vision. So this is generally missed because many a time, so most of the time people go to ophthalmologist and a thorough evaluation may not be done. So visual symptoms are one of the most common symptoms of multiple sclerosis, and any person with optic neuritis should have a neurologist consultation because that may be the early sign of multiple sclerosis. The central symptoms are severe fatigue, cognitive impairment, memory disturbances, mood swings, depression, anxiety, difficulty in remembering things, difficulty in focusing things, then difficulty in swallowing, to sudden change in speech. So if you're not able to have a clear speech, if you're slurring of speech, if you cannot speak properly or understand things, if you have difficulty in swallowing, if the nerves to your swallowing muscles are affected, it will cause difficulty in swallowing. Then it can cause your paralysis. It can cause paralysis of your hands, legs, both legs, or one arm, one leg. It can cause imbalance while walking. So if it affects certain balance areas in your brain, it will cause you to have imbalance. You may have the tendency to fall. It may cause spasms. You may get painful pain. So this is mainly neurogenic pain. This is not a muscular pain. So you may get burning sensation, tingling sensation, numbness, loss of sensation in certain areas of your body. Other are bowel and bladder. So sometimes patient may just come with urinary retention. They may have inability to pass urine and they may go to a urologist, but the problem may be because of multiple sclerosis. So loss of control over your urination, loss of control over your stools, or incontinence of stools or constipation. This can be a sign of multiple sclerosis. So as I described before, the symptom varies from individuals and are unpredictable. Most common are fatigue and loss of vision, then paralysis, bowel bladder dysfunction, sexual dysfunction, emotional disturbances. Spasticity means tightness in your legs, in your hands, imbalance, tremors. So how is multiple sclerosis diagnosed? So multiple sclerosis is a diagnosis which involves multiple factors. One is the doctor will see for the various signs and symptoms. So the symptoms which I mentioned above, that should be carefully watched for by the patients. So if any of those symptoms the patient have, they should directly meet a neurologist. So the doctor will examine you, he will take a proper history, and there are certain laboratory tests. So multiple sclerosis is usually a disease which occurs, the attacks occurs repeatedly. Means the person will have it depends upon the number of times the person have relapses. So usually it requires dissemination in time and space. What does it mean? Disseminated space means there is evidence of scarring in two different areas of your brain. Disseminated in time means that there are attacks occurring at different times of your lifetime, and there shouldn't be any other cause. But however, multiple sclerosis, there are many disorders which can mimic multiple sclerosis. So your doctor will rule that out. It may be infections, certain infections of your brain. It can be certain spine diseases. It can be motor neuron disease. It can be B12 deficiency, simple cause. It can be a dreaded cause like tumor in your brain. It can be certain other autoimmune disorders like lupus, vasculitis, sarcoidosis. So there are many other causes which many other diseases which can mimic multiple sclerosis, and those have a different treatment. So if there are any signs of symptoms of multiple sclerosis, your doctor will usually advise a MRI. CT scan is usually not very sensitive. MRI is a gold standard investigation. And there are certain, it is not just MRI, there are certain protocols which your doctor will ask for, special sections which is required. So you can see this is a healthy brain. It is a very clear brain. You can see a gray matter, white matter very clearly. And this is a MRI of a person with MS. As you can see, this small white dots. So these white dots are called as MS plaques. So these are the areas of the brain which has been inflamed and this has been damaged by that autoimmune disorder. So these are the called as multiple sclerosis plaques. So over a time, if you don't treat multiple sclerosis plaques, this will go on. So it starts with a single plaque, then it may go on accumulating over time. Then you may have something like this, in which there are multiple white dots you can see. So this is more of a untreated multiple sclerosis. So this, if it is untreated for a long time, then this will accumulate over time and cause lots of disability. Other test which is usually done is called as lumbar puncture, in which a fluid, cerebrospinal fluid will be removed from your spine and sent for testing. This is a very important test for diagnosis as well as to ruling out other diseases. Visual evoked potential, that is another test. So the multiple sclerosis, based on clinical profile, it has been divided into 4 types. So it is important when a patient comes to me with multiple sclerosis, I spend lots of time after asking patient about the course of the disease. That's important because each type of multiple sclerosis has got a different treatment protocol and different treatment option. So if a person doesn't give you a good history, if the patient doesn't give you a good history, then his treatment won't be proper, because one form of multiple sclerosis, the treatment which is available for that may not be effective for the other form of multiple sclerosis. So there are mainly, it has been broadly divided into 4 types. One is called a relapsing remitting multiple sclerosis, RRMS. This is the most common type which we see in our practice. Second is secondary progressive. Third is primary progressive. And fourth is progressive relapsing. I'll just show you whatever that. So this is relapsing remitting multiple sclerosis. So as you can see here, there are attacks which are occurring at a specific intervals. So these are relapsing remitting if person will have attacks of relapses of multiple sclerosis attacks, and in between the attacks will be good. So there will be attacks which is occurring maybe in January, then again in March or next year, then again in next year. So in between period, he is usually normal or has got mild disability. Secondary progressive is the person starts with relapsing RRMS, so they get attacks like this, and gradually they will have continuation of symptoms. So their disability will gradually worsen. Third is a primary progressive. Primary progressive multiple sclerosis, it doesn't present with attacks. It doesn't present with relapses. So the patient will usually not come with a single attack. The patient will not come to that he has a weakness in 1 day or 2 days. In this, the patient usually comes with history of months of symptoms. So he will be having maybe 4 months history of difficulty in walking, 4 months history of imbalance, and this gradually increases. So as you can see, there are no definite attacks like this. It is a continuous, it's a slowly progressive disease in primary progressive. Fourth is primarily relapsing multiple sclerosis. So this is a combination of RRMS and PPMS. So it will start with the primary progressive like this, slowly progressive attacks, and suddenly there will be a major attack. Then again, patient will have a stable course. So these are the major forms of multiple sclerosis, depending upon the patient symptoms. So what are treatment strategies? 30-40 years back when MS was used to be diagnosed, there was not much treatment available, and it was a very dangerous thing to have a MS. But now with so much advances in medical line, there has been treatment options have increased a lot over last 10 years. So the treatment of MS falls in 5 general categories. First is the treatment of relapses. Relapses mean exacerbation, that means flare up or attacks that last more than 24 hours. Second is symptom management. Third is disease modification to prevent new attacks. Fourth is rehabilitation. And fifth is psychosocial support. How are relapses treated? So relapses are acute attacks of weakness or any symptom which causes inflammation in your brain. So it is usually treated with IV pulse steroids, which usually it is most of the time it is effective in terminating the relapse. Also, there should be rehabilitation in the form of physiotherapy to improve the function. Third is psychosocial support. So what are MS symptoms? And so how you differentiate between symptoms and relapses? So relapses are definite attacks. So a person will suddenly have a worsening of symptoms. So he may suddenly have increase in weakness or suddenly have increase in numbness, which occur over several days. So these are flare-ups of disease activity, and those need special treatment. MS symptoms are chronic symptoms like fatigue, like weakness, which are not increasing, which have occurred in recent past. So these are all interconnected symptoms. So patient with fatigue may have cognitive dysfunction that causes decrease in sleep. Also, bowel bladder dysfunction can be a result of spasticity, constipation. All those things can cause sexuality issues. So all the symptoms are usually interconnected. So recommended. So MS treatment is a multidisciplinary approach in which includes patient education, because that's the most important thing. Symptom management, disease modifying therapy, physical activities, which is one of the most important part in rehabilitation. So managing patient symptoms. So depending upon the patient symptom, the doctor will give you various medications. So if your fatigue is a very common symptoms, so there are various CNS stimulants, there are antidepressants which can improve fatigue. In terms days, fatigue can also improve with various treatment like physiotherapy, exercises, counseling, use of assistant devices, aerobic exercises, etc. Pain is usually managed with various medication which can reduce neuropathic pain like carbamazepine, gabapentin, etc. It pain also improves with exercises. Cognitive dysfunction, the main treatment is cognitive rehabilitation, because no medication has been found to be very beneficial. Another cause of cognitive dysfunction is depression because of the diagnosis of multiple sclerosis. So it requires a evaluation by a psychiatrist. Also, it requires a proper neuropsychological rehabilitation. A good sleeping habits, a good healthy lifestyle like regular exercises, regular reading, keeping yourself mentally active also helps in preventing cognitive dysfunction. Bladder, so urinary problems are one of the very disabling symptom of multiple sclerosis. Many patients come to me with urinary retention, difficulty in control of urine. So there are various medication which can be used to improve the symptoms. There are various behavioral medication like time voiding, going to reducing your intake of water in the evening time, going to pass urine before going to sleep, then time voiding every 2 or 3 hours. And it is also important, if no symptom, no medication or behavior modification helps, then you do something called as self-catheterization, which can be taught. Bowel dysfunction is constipation, then sometimes there may be incontinence. So there are various medications, there are various non-medical approaches are most important, like having a good diet rich in fiber, good hydration, regular exercise, good water intake, and dietary counseling. Then spasticity can be treated with various anti-spasticity medication. We use intrathecal baclofen, gabapentin, etc. Spasticity can also improve with various physiotherapy exercises. Mobility impairment can be treated with delphimpyridine, and regular physiotherapy for and proper exercise program. Then mobility aids, occupational therapy assessment for rehabilitation with various assistive devices. So it's as I told you, it's a multidisciplinary approach. It involves the neurologist will take the help of a physical therapist, a psychiatrist, occupational therapist, a speech therapist, a neuropsychologist, a social worker. So it's a multidisciplinary approach for care of the patient. So apart from treatment of symptoms, which I described earlier, there are the medication which are there to prevent relapses. The main factor in preventing disability is to prevent the relapses. So how do you prevent relapses? So there are various disease modifying agents. So when we first started 20-25 years back, there was only injectable medication. So even 15 years back, we used to give only injectable drugs like interferons, which used to be taken every thrice a week, or sometimes twice in a month, sometimes thrice in a week. So there are many. So most of the options which were available to us 15 years back or 20 years back were injectable. And that was a little bit, though very effective, it was cumbersome for the patients, as well as it was difficult. The compliance used to be an issue. Now there are last 10 years there have been various advances in the form of, there have been many oral medication. So now most of us prefer oral medication because of the ease of administration. There are no injection involved, and they are very effective. So gone are the days where there was only injectable options. Now there are also oral options. But however, the treatment options depend upon your treating doctor, what he will choose, because there are various factors which we take into consideration. in very severe, where sometimes the MS can be very fulminant, but that we see maybe 2 to 3 in a year. Those require very aggressive treatment with various injectable medications called alemtuzumab, natalizumab, etc. These are very infrequent cases, but those need very aggressive treatment. So now the MS is not a disease where you didn't have anything. Now there are many treatment options available for the patient and for the caregiver. So what does these drugs do? So it is very important to explain to the patient that these drugs are not for symptom control. These are mainly for reducing the attack frequency and severity. It reduces the MRI disease bulk. So as I showed you previously, the MRI of untreated MS. So if a patient who is on disease modifying agent will have a very less chances of getting relapses. So the plaque burden will be less. It slows down the disease progression. So you can have a very normal life if you take this medication. So the MS Society National Medical Advisory Committee. So early treatment of relapsing MS. So any person who has got diagnosed with MS, we start them with disease modifying agents, because if you don't treat properly, there will be irreversible damage to your brain neurons. Treatment is most effective during the early phase. So if once that phase has passed away, if you come after a very long time when the damage to the brain has already occurred, the effectiveness goes down. So it is very important to have a early treatment as soon as the diagnosis is done. Problem with disease modifying therapy which patient experience is that it has to be taken for a long time. There is no end point currently, at least, but it has to be taken for many years together. Then we may reduce the dose. So factors affecting adherence is lack of knowledge. So there are many patients who are unaware of the multiple sclerosis. Some patients have unrealistic expectation that it is a short course disease, that it may get better within 3 months, but it doesn't happen like that. It is a chronic disorder which requires long-term treatment. There are many people who go to quacks and all, which give them unrealistic expectation that it will get better immediately, but that doesn't happen. It's a chronic disease, but if treated in right time and for a good amount of time, you can lead a normal life. Denial of an illness, that is people go from one doctor to another because they have a denial of the illness. Worry about the side effects, cultural factors, and lack of support. So there are various issues like cost factors, but now the costs have gone quite down compared to maybe a decade back. So it is very important to teach the patients about what therapy you're going to do, and what are the expected side effects, what are the importance of adherence to treatment. So rehabilitation, I cannot stress less about this, because this is a very important aspect of multiple sclerosis, because what we treat initially is the symptoms and the relapses, but to have the symptomatic relief, there has to be a good rehabilitation protocol, which involves a physiotherapist and occupational therapist and also speech therapist. So strength and aerobic training. So as per recommendation, at least 30 minutes of moderate intensity aerobic exercises. So 30 to 45 minutes is minimum, at least for 2 to 3 times in a week. So strength training should be done at least twice per week of various muscle groups. As per your weakness, the muscle groups will be selected. Gait and balance training, especially in patients who are having imbalance. So gait and balance exercises are very important. Aquatic exercises programs, these are very useful, especially in patients who are having severe weakness. So because of aquatic exercise, that removes the effect of gravity. So patient even who has got severe weakness, he may benefit, he may have easy use of his muscles, and physiotherapy will become easier with aquatic exercises. Motor imagery and cognitive behavior therapy for fatigue, for cognitive dysfunction. So what do we know about MS? So MS is a chronic unpredictable disorder. It affects each person differently. So every person is different. Every patient will have a different symptom. Some may have just vision loss, some may have very severe paralysis. It is very important to know, it is most of the time it is not fatal. It is not at all contagious. It is not directly inherited. So it is not directly genetic, and it is not only disabling. Early diagnosis and treatment are important, because if you don't treat on time, you can have irreversible brain damage. And once the brain axons are damaged, it cannot reverse. And there are many treatment available to reduce the number of relapses and slow disease progression. So it is very important for the patient to seek right treatment. So treatment includes rehabilitation, the relapse management, symptom management, disease modification, and emotional support. So thank you. I hope this short presentation has will help people in understanding multiple sclerosis, because it is quite common in our country, and if it is not recognized at the right time, it can cause severe disability. Thank you.
Thank you, Doctor. It was a very interesting session. We'll go on to the questions right now, and we have a few questions. Doctor, the first question would be how to prevent the risk of aspiration or aspiration pneumonia in multiple sclerosis patients?
Aspiration will occur usually if patient has got swallowing difficulty. So it is usually seen in patients who have got a weakness of your swallowing muscles. So initially, first thing should be to have a swallowing assessment. So swallowing assessment can be done at various levels. One, it can be done at your neurologist level, who will assess for your gag reflex. He will see for your swallowing reflex if it is good, if it is not, if it is a weak or a poor swallowing. Then he may refer to you to a swallowing specialist. So they may do a scopy to see if you are getting any aspiration. So there are various endoscopic techniques to assess where if while taking a bolus of food, if there is some amount of aspiration, that will be detected on that. And if there is some amount of aspiration, there are various swallowing exercises. So various tongue and swallowing exercises can be done. If it is very severe swallowing difficulty in the acute phase, the person may require a nasogastric tube or sometime a PEG tube, but that is in very severe cases. Other things is to take very small frequent feeds. So don't take a large amount of bolus of food at a time. That increases the chance of aspiration. So what you do is you take very small feeds. So divide your feeds into multiple parts. So take it every 2 hourly or every 3 hourly feeds, and each feed should have a very high nutritious diet. So even though you are giving a small amount of food, it should be enough to take care of the nutrition. So taking frequent small feeds is important. And most of the time patients have in neurogenic weakness swallowing, the more problems are mainly for liquids and direct water. You try to make it little bit of semi-solid, little bit of thick liquid would be better for the patient for swallowing. So all these things prevents aspiration. Other than that, if there is gastric reflux, you may treat it with various antacid medications, etc. And another thing is that always feed the patient in a sitting position, and after feeds, patient should be sitting position for at least 1 to 2 hours. So these things will prevent aspiration to a certain level.
Right. Thank you, Doctor. Next question. For our knowledge, would an MRI of the brain be necessary in multiple sclerosis patients?
Yes, MRI is absolutely necessary for diagnosis, because as I told you, there are various. MS is a disorder which has got various presentation. So, and there are various many diseases which can mimic MS. Means they are called MS mimics. So MRI, and as per a diagnostic criteria for multiple sclerosis, there is a MRI criteria. So MRI is a very integral part of multiple sclerosis diagnosis and absolutely necessary.
Right. Thank you, Doctor. We'll be going to the vote of thanks now, Doctor. Good morning, everyone. I'm delighted to get this opportunity to present the vote of thanks for today's webinar. Let me express my sincere gratitude to today's speaker, Dr. Gajanan Panandikar, for sharing his expertise with us and enlightening us with his knowledge. It gave us deep insights into the topic. I'm pretty sure the precious knowledge that Dr. Gajanan gave us will definitely help us as physiotherapists in managing and treating people with multiple sclerosis. Thank you, Doctor.
Yeah, thank you very much for the invite. Looking forward to more such talks.
Most welcome, Doctor. I hereby acknowledge IAP Central Committee for providing us this platform and their technical team for the wonderful, consistent tech support. I offer my sincere thanks to IAP WC Goa team members for working tirelessly in conducting all webinars on a huge scale. I also thank all the attendees for actively participating in this informative webinar. Thank you, everyone. Have a good day.
Thank you all for your time. Have a nice weekend. Thank you, Doctor.
Thank you.